I'm Aaron Bond. I'm a neurosurgeon at the Semmes Murphey Clinic here in Memphis, Tennessee. I also have an appointment as assistant professor at the University of Tennessee. And I'm medical director at the Regional One Health Incisionless Surgery Center, where we have our focused ultrasound system. We do DBS in multiple centers around town. The focused ultrasound is only performed at this one center. Although Abbott and Insightec put this together, and I used many of their slides for this presentation, I have no financial disclosures with them. So first I'm going to talk about essential tremor. And let's watch a little video here of a patient.
Hi, my name is Jody Meyer. I'm from Green Bay, Wisconsin, and I've had an essential tremor for 18 years. I am an office manager for a 911 center where I partake in a lot of meetings. The tremors in my hands. It becomes very difficult to speak in front of the groups and the committees. Being a mother of 3 children, the essential tremor is becoming very, very difficult as far as preparing meals for my children, putting on my daughter's makeup for her cheer competitions, pouring them a glass of milk. I struggle with that every day on how I can try to hide from people not seeing me shake as much as I do today. I would love to cuddle with my children when I'm holding them close and not thinking, are they uncomfortable because of the shaking when we're cuddling?
So essential tremor is a pretty prevalent disease. It affects 10 million Americans. It's one of the most common neurological movement disorders. And if you're on this call, you know all about it on this webinar. It's uncontrollable shaking or tremors in multiple parts of the body. Some people have it primarily in their upper extremities. Sometimes you can have it in your head, your legs, and also your voice. It's a very debilitating condition. Once it progresses to the point, as in these videos, patients tend to have difficulty with their daily activities, such as eating and writing, and this is actually familial in many cases. The pathology of the source of essential tremors is still being understood. Basically, there's some circuitry that connects the cerebellum to the center of the brain and a region called the thalamus, which is highlighted here by this little walnut, the rough size of it. And then that connects to the cortex up here. And the connection of all those circuits, when it's out of whack, is basically when people develop tremors. And what we found is that when we can alter that circuitry, we can effectively eliminate your tremors. And we can alter that circuitry by targeting the area where this walnut is and disrupt it. As with anything, you would always want to try medication first to try and control your tremors. That would be the first line treatment. Typical medications for tremor control include propranolol, or otherwise called Inderol, primidone, gabapentin, and others. Sometimes people can have side effects from these medications and they can't take them, and sometimes they fail to relieve their tremors. And that's when it comes to someone like myself, a neurosurgeon, where we can talk about surgical intervention. There are multiple ways that we can treat tremors with an intervention. One would be an operating room procedure, which would include deep brain stimulation, or DBS for short. Also RF thalamotomy, where we insert a probe and make a little lesion. The other way would be an incisionless procedure, which would include focused ultrasound, or stereotactic radiosurgery. This is where we use multiple elements at lower power, focus them all down to a very small spot and make a little lesion.
In July of 2016, I seen that the focused ultrasound was approved by the FDA. For 18 years, I've been praying for some kind of relief, and it's going to finally become true. This essential tremor is not going to rob my life anymore. When they put the clipboard up and tested how I was able to write, I got overwhelmed with emotions because I haven't been able to write for 18 years. Being a mother of my 3 children, after the procedure, I've been able to pick up a lot more daily tasks that before I used to rely on my children to do. Simple things such as tying their shoes. My family was very excited. I'm able to do a lot more things, more independent, to be a stronger mother, to be a stronger person. I'm able to stay up to speed to make sure that all of my daily tasks are completed. I have more confidence where I'm able to join the group and have conversations.
So DBS isn't for everyone. There are other options. So focused ultrasound is the other option I'm going to talk about today. So this is MR guided focused ultrasound. It's a way to treat your tremors without placing electrodes or batteries. And it requires us to basically create a lesion in the area of the brain where the tremor circuitry is, instead of placing an electrode there. These are just some clips of patients who have been treated both before and after, and you can see there's a very significant reduction in the tremor. The way it works is you come in the day of the procedure, we place a little head frame on, and then we sit you on this table, and you go inside the MRI scanner. We do an MRI scan, do a bunch of planning, and then we start delivering the ultrasonic energy. There's 1,024 different elements that focus down to a very tiny spot where we make a little lesion. As we're making the lesion, we'll bring you in and out of the scanner, and we'll test your tremors, make sure we're making progress on eliminating your tremors, and make sure you're not having any side effects. So again, this is an awake procedure because you need to participate with the procedure. It's very well tolerated. Some people describe that they have some warming of their head, maybe some head pain, the room spinning a little bit, but in general, patients tolerate it very well. And the goal at the end of the procedure is for your tremor to be completely gone. During the day of the procedure, we do have to shave your head. We have to shave the whole head. Then we do the planning after you're in the system. And then, as I mentioned, we do the ablation and we do the testing. And some of you might be familiar with these Archimedes spirals. We might do that during the procedure to make sure we're getting the full effect. This is a proven technology. There was a randomized controlled trial which showed 70% reduction in tremors. And we also have 3-year data which showed maintenance of that tremor reduction. There are some potential risks of some gait and disturbances and some numbness or tingling that are fairly small. When I think about focused ultrasound or DBS, this is kind of how I summarize it for people to make it simple. For focused ultrasound, it's incisionless. I'm not using a scalpel. I'm not drilling a hole in the head. It's an outpatient procedure. You usually show up at 8, you go home at 10:30, your tremor's gone, you go home. You do have a risk of some numbness or some balance issues, and usually that numbness would be in your fingers or your lip or your tongue. And the balance issues, some people have described it as they just feel kind of like they're a little drunk, but that's a very small percentage risk. We're talking about a couple percent. One of the downsides of focused ultrasound is I can only treat one side. You can't come back 3 months later and get the other side treated. It's only FDA approved for one side. So you got to be okay with that. There are research trials to do both sides, but there's no prediction on when or if that's ever going to be approved by the FDA. It also has a narrow insurance coverage for now. Medicare Part B covers this procedure throughout the whole country. There we are making progress with some commercial insurances like Blue Cross Blue Shield, but we're still working through all the details. But if you have Medicare Part B, it's no problem. We can do it right away. It is a newer technology. It was FDA approved in 2016, I think, and Medicare approved in 2017. It does have the downside that we do have to shave your whole head. For DBS, we can typically treat both sides. You can't treat both sides with focused ultrasound because there's a risk of some cognitive and some speech issues. For DBS, we can usually program those out, or in the worst case, we can turn the device off. It does have broad insurance coverage. It's an established technology. It's been around for a long time. We don't have to shave your whole head. We just have to shave part of your hair. But it is an operating room procedure. We do numb up your scalp and everything, but we do have to make 2 incisions and drill 2 holes if we're going to treat both sides. And then we tunnel that catheter down to the pocket here. And it also requires some programming sessions. So you need to have good support really in the family to bring you to clinic and do the programming. And you also do have a risk of infection, or when you place the electrode, intracranial hemorrhage. These are very small risks as well. In general, both procedures are very well tolerated. If it was me and I had tremors on both sides, and I really needed both sides to have the tremor gone, I would go for DBS. If I had tremors only on one side, or I really had an adversity to having the hardware installed, I would go with focused ultrasound. Both of them are really life-changing treatments. So are you a candidate? It's pretty straightforward. You have to have a diagnosis of medication refractory essential tremor. 22 years of older. You have to be able to tolerate the procedure without sedation. So I can't give you a bunch of medications during the procedure because that'll make the tremors stop. So you have to be awake and alert for the procedure. You need to be able to communicate during the procedure. For example, if you had real severe dementia, this would not be something for you because you would have a hard time telling me what sensations you're feeling. If you wanted to do the focused ultrasound procedure, you have to be able to fit in the MRI scanner. I think it's roughly a 300-pound weight limit on the table. You can't have any contraindications to getting an MRI. So if you have some metal in your body or something, then we wouldn't be able to do it. If you had a contraindication to getting an MRI, we could do the DBS. We can do that with just a CT scan. So we're going to go into some question and answer. I'll probably just leave this slide up. This is how you can get a hold of me. That's the number at Semmes Murphey. And then that's the appointment email address. So the first question is an online question. My medication doesn't help me. I'm on topiramate 50 milligrams twice a day. I have tried propranolol. It didn't help. It is embarrassing and frustrating. It affects me cooking, writing, and all sorts of things. This is exactly why these treatments were created. The medications are not 100%. Some people respond better than others. And that's when you get to the point where it makes sense probably to do a procedure. It's really kind of that simple. If the medications aren't working and you can't do what you want to do, and you're willing to take, a small amount of risk, then these procedures might be for you. And I'd be happy to talk to you more about it. I mean, if you're on this webinar, I mean, the challenges. You can't write anymore. You can't eat well anymore. You can't put the peas on your fork. I mean, these are common things people tell me they can't do. I just treated a patient the other day, and he wanted to be able to deliver a cup of coffee to his wife like he used to without spilling it on her. That's what he liked to do in the mornings. They would drink coffee together, and he liked to bring the cup of coffee, and he couldn't do it anymore. So, doing one of these procedures enables you to go back to doing those particular things that you can't do anymore. I've treated patients that like to fly fish, and they couldn't tie their flies anymore. And after the procedure, they were able to do that. There are artists who like to draw, and now they can go back and draw again. All those little things that most people take for granted is what you lose when you have severe essential tremor. And if the medications don't work, these other technologies really do have a chance of helping you return to doing those things. If you're in early symptoms, you should definitely see a neurologist. And they will usually start you on propranolol, assuming you don't have any contraindications to taking beta blockers. And they'll slowly titrate that medication up. And then if that doesn't work, they'll usually try primidone as the next line. And there's a few other ones they can try too. So we try and make it as easy as possible for you to be evaluated. If you were to contact me and request an appointment, we can bring you into the office, or we can set you up with a Zoom telehealth clinic visit, and we can talk about your particular situation. And then I can talk you through the different options. And I often will find patients who've never seen anyone about their tremors, and they want to learn more about it. And I'll send them to one of our neurologists to do medication management. And if the medication management fails, then you'll come back to me to talk about one of these procedures. Other patients I've had have been treated by their primary care physician, but they've been treated very well. They've been tried on propranolol, they've been tried on primidone, and in that case, we can just talk about going forward with the procedure, and we'll go through the details of that. Sometimes patients have only been tried on one medication, and I'd usually like you to be tried on at least 2 medications before going forward with the procedure. And we'd talk about, do you want to do that with your neurologist, or would you like to see one of our neurologists here at Semmes Murphey? It's an open book. If you want to have an appointment, it's very easy to make. And we do the Zoom telehealth clinic appointments as well to make it even more convenient. All you got to do is contact this number or email that address. That's a great question. They are durable. Unfortunately, the focused ultrasound treatment is relatively new, so we can't tell you results out past the 3-year data I talked about, which showed its durability. We expect it to maintain its durability. So focused ultrasound, the biggest risks really are, as I mentioned, some numbness or tingling in either the fingers or the lips. A little bit of feeling off balance, and I guess a small risk that you could have a little bit of weakness in your leg. These are a couple percent risks, and what I like to tell patients is if I treat 10 patients, 8 of them are going to be really happy. Their tremors are going to be greater than 80% gone, and they're not going to have any side effects. One patient might have their tremors reduced, but not quite where they wanted it to be. And maybe one patient has elimination of their tremors, but might have a little bit of a side effect of some numbness or just feeling a little off balance. That's kind of what I've come to expect. With the focused ultrasound, our long-term studies have shown that there is a couple percentage risk, like 4%, 5% risk that it could be a long-term side effect. But so far, the patients we've treated in Memphis, we had a couple patients who had a little bit of numbness, and it actually did go away. It took about 3 months. And we had a patient who felt a little bit of gait instability, and that got better with time too. It's all a matter of, if you are able to get an MRI, then you're able to get focused ultrasound. So we just have to find out if whatever they put in your body precludes you from getting MRIs. Vocal tremors are extremely difficult to treat. Both of these technologies work very well for extremity tremors, and sometimes we'll get improvement in axial tremors, but I would not go into this with the expectation that the vocal tremor would be eliminated. And with focused ultrasound, it's even more selective in that it's really just going to help your extremity tremor. However, that being said, I did have a patient recently where his head tremor went away after focused ultrasound, which did surprise me, but I don't like to promise that. Well, I just appreciate your interest in hearing more about this. I'm here to help. I don't have a bias one way or the other for DBS, focused ultrasound, or whatnot. I will just recommend whatever is the best for you. I can give you an honest opinion for your situation, because I do all of it. And if you want to talk some more, I'd love to see you in clinic, and we can talk some more about your particular options.
Great. Again, Dr. Bond, thank you very much for your time, and thank you for explaining these transformative therapies for essential tremor patients. And I hope everyone was able to learn a little bit more, not only about essential tremor, but the options that you have to take back your life. Thank you very much, and have a good day.
Thank you. Take care.